Okay, so talking to my mother, I am going to ask you questions about the concept of discourse community. And I'll just read you the instructions for the assignment and then we'll go into the questions.
Okay.
Contact at least 2 people who are experienced workers and inhabit a particular workplace discourse community. Interview them regarding their experience in and with this workplace discourse community and any additional discourse communities they may participate in to augment or supply their role in the workplace discourse community. Use the following questions as a guide and write down blah blah blah. You'll probably need to have an introductory discussion asking such as what we mean by discourse community, mechanisms of intercommunication. So, first question, how long have you been a member of this specific workplace discourse community? So you work at Winter Park Hospital, and you've been working there for
32 years.
32 years. Is this different than when their interest or experience with this discourse community first began? And if so, when did this happen and in what ways? So,
Well, when I started working as a nurse, I was a staff nurse. So most of my communication was with my patients, with physicians, with my leaders, and I didn't do a lot of writing of memos or anything like that. I usually just read things that people posted and stuff like that. But as I went through my career, as I went into management, then I was responsible for writing memos, receiving memos, emails, I wrote coursework for a critical care course. So different things have changed. Yes, through my career, many things have changed.
can you go from like the very first beginning place, from when you graduated from nursing school? What did you go into? Where did you start? And what types of like specific work did you do?
I was a staff nurse on a surgical floor in Ohio at Fairview General Hospital. So I was in patient care at that time. I was a staff nurse, so most of my care, most of the things we wrote at that point were things in our charts that we wrote notes to the physician so the other people that were taking care of the patients could know what care we delivered, what events had occurred with the patient during our shift, what dressings changes were done, what wounds looked like, things like that. That was the most communication that I did at that point in my career, because that was the earliest part of my career.
You did start out writing charts like, any normal nurse would do, going into rooms and writing down, looking at their charts, reading what doctors have said and whatever.
Correct.
Okay. Second question, what are common goals of your workplace discourse community? What's the main purpose, or what does your community hope to achieve?
Well, I can't think of the word for preeminent faith-based healthcare is the motto of the Florida Hospital Organization, extending the healing ministry of Christ. So technically, what we're there to do is to fulfill that mission. That's the mission statement. And by doing that, is providing good care to our patients, good, safe, effective care to the people that come into our facility that need care.
The second part of that question is, who are the members of this particular workplace discourse community? So, the questions together are, what are the common goals of this workplace discourse community? Who are the members of this particular workplace discourse community?
It's physicians, it's the other nurses that I work with, it's the other healthcare workers such as respiratory therapists, physical therapists, lab people, transportation, anybody who touches a patient or anybody that touches anything that involves patient care in any way, shape, or form is part of that community.
Okay. And being a member of this workplace discourse community, are they also members of an additional discourse community? For an example, an engineer may work for a certain company, the workplace discourse community, but may also be a member of an association of engineers. So you work at the hospital, but are you a part of another discourse community for yourself? Or do you...
I have another project that I work on at work that's a new bed management program that we're working on. So over the last year and a half, I have worked on a specific group with a specific group of people that are helping design and kind of tweak the program so that it works for our situation for Florida Hospital. So we've met we met every week for probably 7 or 8 months, where there were a group of, I'm a nursing supervisor now in my current position, nursing supervisors from all the other campuses of Florida Hospital, plus the programmers and the other people and the subject matter experts that were working on this project trying to get it organized. So that was probably one of my biggest things. The other thing I've been involved in was the National Association of Healthcare Quality.
Mm-hmm.
And I've gone to some of those meetings, and that's about patient safety and quality things. And those are mostly nurses that I deal with at that meeting.
Since you, like, your main title is nursing supervisor, would you say that's like another discourse community, as in, for being a nursing supervisor, all the other nursing supervisors that you work with is one community itself?
That is the closest community I work with, because there's only 5 of us. So with the 5 of us, communicate with each other practically on a day-to-day basis. Every day we work, we communicate with each other because we have to give each other a report. We have to tell about events that are going on, what staffing issues there are, things like that. So we share a lot of information back and forth with each other. Plus we write each other a lot of emails, because some days, since I work 12-hour shifts, some days I'm not there for 2 or 3 days at a time. So I usually get emails from people if there's something that's changed or something that I need to be aware of, and that's probably one of the biggest forms of communication we get now.
The second part of that question, it says, who are the members of additional discourse communities the interviewee participates in to better function with the workplace discourse community? As you said that you work with 2 other different groups that you learn about patient safety and stuff like that, so we kind of went over that.
Mm-hmm.
It says, for each discourse community you've noted, determine the following. What are the common goals? What are the common values of the members? What is or are the purpose slash purposes of the community? So, for each discourse community you've noted. So, is there anything outside of Florida Hospital that you participate in that would be a discourse community that would be like, maybe like a sports kind of club thing, or...
Well, I was very active with the high school, with the band, and being helpful with the band as far as being a nurse and helping, with performances and attending parades and helping plan trips and things like that. So that was something else outside of work that I did.
Okay. It's another question. What mechanisms of intercommunication do the members of each discourse community use? So you said, right now...
Right now, we talk face-to-face is the biggest thing between the supervisors, because we pass report from shift to shift every day. And then we email memos. We have a mission meeting every morning where everybody comes to the office, my office, and every charge nurse of every floor, plus the leads of all the different departments of the hospital, all come together, and we talk about how many beds everybody has, how many discharges they're anticipating, if there's any needs that need to happen so people can be discharged earlier so we can keep the emergency room flowing easily, because that's one of the biggest challenges we face now is the ER overcrowding, and we try to keep that from happening by moving people through the hospital as quickly as we can. So discharges, talking about daily discharges is one of the main focuses that we do, because my main job at this point is bed management and making sure people get to the right beds at the right time in the right place where they need to be for the care that they need.
That kind of goes along with what types of information or feedback does each mechanism provide, and how does the interviewee use each of these mechanisms? You just described what you talk about and how it kind of distributes out.
If you saw my office, I have 4 computer screens that I work off of on any given time. I actually have 6 now, where one is showing me constantly what's in the emergency room, so I know what the influx of patients is going to be. I also have another screen that when the bed is requested from any place in the hospital, either to change the level of care or come in from the emergency room and be admitted, that's a way of me placing that person in a bed in the computer system so that the floor has that person where they need to be. I have another screen that shows me what's going on in surgery at the time, so I know when the surgeries are coming out and when they're going to need beds. So it's all like a big puzzle you got to play with all the time. But that's another form of communication that I have, because I rely on the thing, especially the tracker from the emergency room, because that shows me, I can anticipate what kind of beds people are going to need by seeing what their major complaint is when they come in through the door. By seeing what they say their problem is, I can kind of anticipate that they're going to need that kind of bed.
For, different floors?
For different floors. Like, they're going to be a chest pain patient that's going to need a progressive care level bed, or they're going to be a surgical patient that has appendicitis, they're going to need to go to a certain floor. Or if it's somebody who's really sick and needs to go to ICU, I can anticipate that by looking at what's on the screen.
Okay. When and how did you learn to use these? So, obviously, technology is progressing each and every year, and so somehow, if they change technology, someone's going to have to teach you how to use it, or someone's going to have to teach you how to
do it
differently.
I went from not using computers when I started out as a nurse, never using a computer, to slowly using it for just order entry was the original thing that we did for us, putting orders in the computer so that different departments knew that there was a lab test due or an x-ray due, to now complete computer charting as a staff nurse, that you do complete computer charting. I mostly rely on computers now, and that's the main thing that I have.
Okay. It says, what genres does each community utilize in order to function? What role does each genre play, or what purpose does each genre serve? So, in saying, like, what genre does each community use in order to function, there are, like, specific ways that these communities function, and